Tech writer Carla Nierlich has suffered with migraine headaches all her life. They didn't happen often and usually got better with medication. But then something changed.
About 2.5 years ago, the nature changed. And instead of having, really blinding headache once a month, I would have a low to mid-grade headache 24/7. Well, I couldn't concentrate in front of the computer for very long. To look at a screen, because that's what I do for a living, to look at that screen and be able to really focus, because I have a very detail-oriented job, and it has to be done quickly. And when you are in that much pain, it's really hard.
Carla tried everything and nothing helped until she met Dr. Patricia Scripko, a Harvard-trained neurologist now living and practicing on the Central Coast.
The reason that these headaches are so different and so debilitating, along with a couple other subtypes, is they really disable the patient. They make it so that normal sensory stimuli that normally wouldn't make you feel pain or discomfort at all of a sudden becomes intolerable.
Salinas Valley Memorial Healthcare System brought Dr. Scripko to the region to do what no one else in the area is doing, set up a state-of-the-art headache treatment program, one that includes outpatient services and an intensive inpatient infusion program specifically designed to treat migraines. Dr. Scripko believes the key to treatment is individualized care, encompassing everything from medications to injections, diet, stress, and new high-tech headbands delivering electronic pulses to the brain. Dr. Scripko begins every day with an early morning run, a kind of mind-body jumpstart. Dr. Scripko suffers from migraines herself and knows just how devastating they can be. Her own struggle pushed her to specialize in how to treat these types of headaches, which go far beyond the run-of-the-mill, take an Advil kind of headache.
My goal in the end was to develop a multifaceted headache center and approach that could make a lot of people's lives a lot different than what they are.
I have to keep living like most people. I have a family, I have responsibilities. You can't just stop. So being able to have a toolkit to help you so that you can function is something that Dr. Scripko is able to do for me.
Marisa Baker is another of Dr. Scripko's patients. Her constant and severe migraines made it impossible for her to function. After exhausting all other options, she opted for the intensive inpatient infusion therapy.
So basically, I was in the hospital for 5 days. They gave me an infusion, which is called DHE, 3 times a day for 5 days.
The inpatient infusion treatment is intense. It requires a commitment of 5 days in the hospital where a powerful amount of medicine is delivered through an IV.
And what we've seen based on the literature is that anywhere from 65 to 80% of patients get marked relief from their headaches, and oftentimes they become headache-free.
Traditionally, migraines have been difficult and complicated to treat. Symptoms can range from vertigo to blurred vision to hypersensitivity to light and noise. Even the medications for the headache can be a problem.
What happens when the headaches become more frequent? People start taking more and more medications, and most of the medications we use for headache worsen headache if you take them more than 2 days a week.
Part of Dr. Scripko's regimen is getting her patients off the medications, establishing a clean slate, and then starting a highly individualized and supervised treatment program. For many patients like Carla, outpatient treatment is enough.
When the headaches were chronic and there's no relief, I wouldn't want to listen to any music, ever. I wouldn't want any noise in the room. I'd want the TV turned down. And I would realize I was getting better when I would turn the radio on when I started cooking dinner. I'd say I'm 75% there, but considering when I met her I was at 0, I'm really happy with it.
For others, inpatient infusion is the answer.
Based on the research that has been done, and then also what we've seen with our own patients, we're incredibly happy that we're able to get people back to work, get them off of medications, and as one of my patients put it recently, let them wake up.
And that's exactly how Marisa feels. She hasn't had a headache since her infusion therapy several months ago, allowing her to get back to what she loves the most.
My family is happier because they have their mom back.